Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, it's so interesting for me to talk with a CEO of a hospital because we talk with so many CEOs, but not usually hospitals. But Jonathan Watkins, welcome to our show.
Thank
Broward
you.
Health, Imperial Point.
Yes, ma'am. Thank you so much for having me.
It's a pleasure. And you know, I guess I'm going to start off by just saying, you're not here from South Florida. Where are you from?
No, so I'm originally from Memphis, Tennessee. That's where I was born and raised. So you may catch a tinge of Southern accent as I speak. But I moved here from
Did you bring your
California.
guitar?
I don't play the guitar.
Memphis? I can't be in Memphis. Okay, sorry.
No.
Sorry.
But I came here from California. I was the chief operating officer within the Kaiser Permanente health system for about 2 years before South Florida came calling, and I couldn't say no to this weather.
Right. Well, of course, California's not bad either.
No, not too bad, yeah.
Well, that's interesting that you say that because people are always looking for young executives who really have experience, but that can bring new cutting edge, I think, you know, executive leadership. And
yes,
that's what everybody needs, leadership nowadays.
Well, I think so. Yes, ma'am.
And you feel like a leader?
I do. Yes.
The word is out about you that you are a leader, so.
Well, I'm appreciative. I have a great group that I'm able to work alongside of, and our care is first and foremost for us. What we do for the patients that come into our hospital is always our number one priority. So if we're all focused on that, it's easy to work together to make the best decisions.
Right, and decisions are always being made at hospitals where patients don't really know that. You know, patients feel it. They don't know who's up there doing things.
Right.
They know it when they get into the emergency room, when they get into the patient's room. And so that's a big responsibility for you.
It is. It's about setting the tone and creating and establishing the culture that you want in the hospital so that everyone knows that they are free and available to speak, share ideas of their own, suggestions on how we best provide care for that patient that's coming to the facility. I tell my team all the time that I went to school to learn how to manage the finances and the operations in a healthcare facility, but I don't know what to do when that patient comes in need of care. That's where they come in. And our ability to work together to leverage my expertise and theirs will help take the organization truly to that next level.
You know what you need? You need heart. Lots of heart.
Oh, yes, ma'am, without a
Yeah.
doubt. You have to truly care for the people that are in the community that you serve. And if you can do that, again, you're able to really succeed and excel.
One thing that I have loved when I've gone to Imperial Point, because that's one of my favorite hospitals, is
Good.
the way that the employees, whether they're the people working in the kitchen,
Yes,
or that they're just, you know, they're nurses, or they're the doctors. But I have to back up. You have the best gift shop in the entire.
I do.
You do.
You're absolutely
I go there.
right.
I buy all my gifts at your gift shop.
Good. Christmas time is coming up, so
I know.
encourage you to come on in and rack
yes,
up.
because whoever the buyer is,
Mhm.
they really, of all the hospitals in Broward Health, I
Thank
must tell
you.
you, you have the best gift shop.
Good.
Yay, gift
Yes.
shop. But so you got to be really. But those volunteers there, I mean, they're just lovely.
Oh, they're an invaluable asset to the organization. Again, I meet with them probably once a month or every other month or so, and we have very candid conversation about how we can again continue to advance the care we provide. And they hold they pull no punches when they're talking to me. They're very honest. Again, they're volunteers, so they're not concerned about what's going to happen. They've been in the organization for years and have a wealth of knowledge. So I really rely on them.
So you come in and you're new in a sense, of
Right.
course, but not so new now. You've been there, what, 6 months?
About 6 months now. Yes, ma'am.
I saw you when you first came. I was so impressed with you. I said, oh my gosh, where'd they find him? We thought you were a child, really, just dressed up as a man, but you're so attractive and you're so open and
Thank you.
Your philosophy was so good when I heard you. But I want to ask you, what are the challenges of a CEO in a hospital of that magnitude?
They vary, to be totally honest with you. So healthcare legislation is probably the biggest challenge on how we're reimbursed and how we're paid and compensated for the care we provide. Broward Health is a tax-assisted public facility. So by virtue of that, we take pride in caring for an indigent population, or a larger portion of the indigent population than probably some of our sister facilities across the county do. And with that come naturally challenges to how you're reimbursed for that care. Without any margin, there is no mission. So we have to get creative in how we best reduce expenses to ensure that we have the resources and the means to ensure that we see no degradation in the quality and the service that we provide. So I would probably say that's probably one of the biggest challenges that we face, is just the legislation around healthcare and the way we're reimbursed. And with those financial challenges, it pushes and encourages creativity in how you're able to reinvest in the community and what services you offer.
Out in the, I don't know how often you have, where you have the you have people come and they have all this little food. I forget what that's called.
Yeah, so we have a number of initiatives that we do, and we try to encourage the community to get involved in. We have Lunch and Learns, which is an opportunity for us to really get a member of our medical staff or a member of our healthcare system to just talk about the services that are offered in a way of educating people before they come into the hospital on the receiving end of that healthcare. We have another initiative that we call High Tea and Trivia, where we
go to that. I love that.
Thank you. We serve tea and have, again, very candid conversations with people. We bring in medical experts to talk about a variety of topics. Last month was naturally Breast Cancer Awareness Month, and during it, two of our physicians, Dr. Stokes and Dr. Tranicus, gave a wonderful presentation around breast cancer education and how we can make sure that as both men and women, we're taking care of ourselves to ensure that we don't become victims of this unfortunate disease. And if we do, how we best treat and care for ourselves.
That's funny you should mention them, because they asked me to be the moderator at Broward Health North, and they had a cancer symposium. And Dr.
Did you enjoy it?
Well, I did, but Dr. Stokes is not to be believed. And not to be believed is what she did. And then we had, of course, the young woman who was, is it Stacy, the young woman who was the one that had the double mastectomy, the breast?
I'm not
sure. A very young woman in her 20s.
Okay.
And she told the story, and I have to tell you, it was the most impactful symposium. And, but Dr. Stokes is someone I want to get on the radio show also, because she is like a Wonder Woman.
I think you really should.
Yeah.
Yes. She has an amazing story to tell.
Right.
And more people should hear.
And so I know you have a lot of support groups, and we try in Boomer Times, we list the support groups, and because support groups, as you know, are so good. I mean, they help everybody feel better about themselves.
Yes, thank you for assisting us with that. The more we can promote and share that message, I think the better we all are. Yes, we have a number of them, ranging from diabetes management to suicide survivors, which are the family members of those that have been impacted by suicide. And we really want to just offer an opportunity to talk, opportunity to share, and you realize and understand that you're not the only one that's been dealing with an issue, and you're able to work together and again, figure out how we just convalesce together.
And you have a great community relations meeting. That's where I first met you when you spoke. And the interesting thing there is they bring up, I know the first time I heard about FLACA, the officers, that terrible stuff that kids took or people took and it killed them. But they provided, the sheriff and the people provided a lot of insight into that. Yeah,
so we try to collaborate with the community, and we understand and realize that the first responders, our police services, our EMS providers, our fire department, and the hospital all have to work together to best serve the community. So we invite them into the facility to be a part of those conversations, again, understanding that healthcare is very much relying on partnerships in order to best care for and support the communities we serve, and we engage them routinely, and think that's the best way to do it.
And actually, I just want to tell everybody again, your name is Jonathan Watkins, and you're the CEO of Broward Health, Imperial Point, and you are from, I guess you're from California. Well, no, you're Memphis, but you wound up in California.
I did.
And I was so happy that they found you and they brought you down here. We need new, young, pardon the expression, blood, to be here and bring all your ideas.
Yes,
that's
ma'am.
really,
I appreciate that.
Yeah, that's really what it requires. So, Jonathan, you talked about volunteers, of course, in the gift shop. Would you like to invite volunteers who are listening to this show?
Yeah, thank you so much for the alley-oop there. I would love to. So we're continuously looking to continue to grow and expand our volunteer program. They are an invaluable asset to the organization. So for those of you that are out there in the listening world that have a desire to continue to give back and you think healthcare may be that space for you, please, Broward Health Imperial Point is the place to be. 6401 North Federal Highway. We welcome you.
Yeah, that's true. And volunteers, I see some walking around. They must be 70, 80, 90 years old. They love this.
They do. Some of them are, but their energy is that of a 20-year-old. They have, again, have amazing ideas and are always looking for ways to engage the community in their health care.
Well, I'm going to take a little diversion here. Tell me about your family. You must have a family. You're just too attractive not to have a family.
Thank you. I have an extremely beautiful wife of nearly 5 years. On February 14th, in fact, Valentine's Day, we'll celebrate our 5th anniversary. And we celebrated the birth of our first child prior to us moving here. We have a baby daughter, Jenna, who's 7 months now. She's 7 months and is the
light
apple
of your
our
life.
eye. Yes.
I know, I can see that.
Yes, definitely.
Yeah, so you know, and you have a mother and father. Where do they live?
Our families, both mine and hers, live in Memphis, Tennessee. In fact, my mother-in-law is here now. I had a cousin that recently got married, so my mother-in-law was kind enough to fly here to stay with our daughter so that we could go to the wedding. And she's been with us this week, hanging out and enjoying South Florida because it's actually cold in Memphis right now.
Yeah, I'm sure. It's funny you even allowed anyone to take care of your child.
Oh, we trust her.
No, but young parents are so different nowadays. So we couldn't wait to get rid of our kids.
No, I
know.
Yeah, yes, and that's why. So I told my cousin when we got there, I said, "This shows that I really, really love you."
Right. To let them do that.
Yeah.
But tell me what your hospital specializes in. Every hospital has some really specializations.
Yeah, no, thank you so much for asking. So there are a couple service lines that we really are endeavoring to grow that we do specialize in, one of which being robotic surgical services. So we were the first hospital in the Broward Health system to acquire the Da Vinci robot. So we do many of our general surgical cases with the robot. It calls for a lot smaller incision than you typically see. So because the hand can only turn so far, it calls for the physician to have to make a larger incision to be able to operate. Because of the robot, though, and its hand being able to truly rotate 360 degrees, you're able to create a smaller incision in the patient and operate. The smaller incision, of course, means less blood loss, quicker heal time, faster recovery, and a lot less painful. So we're very proud of that. We do bariatric surgery at the facility, plastic surgery.
We'll go back to bariatrics.
Yes.
So people don't know what that word is.
Oh, I'm sorry. Thank you.
Okay.
So for those individuals that have conditions in which they're medical conditions or where they be cosmetic, that are obese and believe they'd like to lose weight and are struggling with it, we have physicians that specialize in that. You can come see them. They'll counsel with you, talk with you, and decide the best course of treatment. And if it's deemed and determined that surgery is the best way for you to go from a health standpoint, they'll gladly support you in doing that.
But let's then go way back to robotic surgery. You don't do robotics on all sorts of surgery.
No, there's certain
specialized?
there's certain cases, hernias, some obstetric cases that are done using the robot, but no, not every case. Orthopedics, for instance, no, we don't use robotics for orthopedics. Even some general surgical cases are not performed with the robot. It's depending on the surgeon and his or her level of comfort with the robot.
Right, and everyone should know it's very expensive. The robot is very expensive to purchase.
The machine itself is expensive.
Yeah.
However, the return on the investment is pretty significant for us because, again, it's about patient safety, it's about quality. You reduce the likelihood or the length of stay for the patient when you are able to use it. So it's been a good investment for us, and it's a machine that, again, doesn't require a tremendous amount of maintenance, so it's not breaking down, and it has a pretty durable, long lifespan.
I know we had our Boomer Expo, and we had someone, not your organization, but we did have a robotic arm come in. It's huge, and it was very interesting. And people, they did some things with people so they could understand
how it works.
Because for first, it seems like there's a robot that comes in here and does this, and we know it's not true.
Right. It's more like, actually, my wife is an OBGYN physician that knows how to use the robot.
Now you tell me that.
Right. And for her, I tell her, and we talk about it, it's like playing a video game. You're sitting in the corner and you're maneuvering it, and the robot's actually, the arm of the robot is doing the work for on the patient.
Yeah, that's right. And I saw it too. It is very interesting.
It
Okay,
is.
so now you've covered. I'm sorry, I didn't mean to interrupt you.
No,
Bariatric, the robotic, and what else?
Yeah, so we also do a lot of eye surgical cases. We have a outpatient surgery center that...
I didn't know that.
Yes, in fact, so funny story. Shortly after joining Broward Health, I was at work one day and reading, and I thought my contact lens was just old, needed to be changed because my vision was somewhat blurred. Went home, took my contact lens out that night, put my glasses on, vision still blurred, not sure. I sent my admin assistant an email to say, hey, see if you can get me in to see Dr. Elgut, one of our ophthalmologists in our medical office building. Dr. Elgut was kind enough to see me the following morning, went over, saw him, and within a few minutes of examining my eye, he said, uh-oh. And you never want to hear the physician say, uh-oh.
Uh-oh.
He said, I think we got a detached retina here.
No kidding.
Right. Fortunately, we have an amazing retina group on the 4th floor of our medical office building. I was able to go up, see Dr. Del Cid, one of the ophthalmologists there, who said, yep, decided they would send me downstairs and perform the retina reattachment surgery right there.
That was pretty serious stuff.
Yes, very serious. But the recovery time was amazing. I have complete recovery of my vision now and no problems.
Wow, and it just happened? It wasn't anything that you
No
did?
trauma. No trauma. I'm very nearsighted, and the way they explained it to me, so this is kind of cool too, is the eye, the way the retina is typically shaped like a tennis ball. It's round, or a golf ball. Because I'm very nearsighted, mine is stretched, or shaped more like a football, which causes the retina to stretch to cover it. So because it's stretching to cover it, and at times liquid can begin to accumulate behind it, and like wallpaper, once you're pouring wallpaper down the wall, it'll start to slowly detach, and then it completely detaches.
Right.
I was starting to experience that detachment. Fortunately, again, I was in no pain. Like I said, I thought it was just blurred contact lenses. And was able to go in, repair it that day, outpatient surgery, back home. This was the 4th of July weekend. In fact, we were scheduled to travel. Recovered within a couple days or so and was back at work.
Isn't that now? See, that was really an amazing story.
Yeah,
now you got to see how your hospital really works, right?
I was able to talk to him during the case, ask him about his training, see how they treated me as a patient. Yeah, so again, we have an amazing outpatient surgery center as well that we run.
And it's right there inside the hospital. It's outpatient, but it's
an outpatient surgery center that's attached to the campus. So it's on the same campus, but it's not in the hospital.
Okay.
Yeah.
Well,
we also have a very proud rehab department or rehab department that we're extremely proud of, I should say. Patients that complete their orthopedic surgery go there because orthopedics is again one of the specialties.
Yes, you do have some fine orthopedic surgeons there.
Yes, some of the best in the city.
They don't have to go somewhere else. You're saying they can
come right there and partake and have your rehab done in the facility. So because I like to engage my team in the organization, work out on occasion in our rehab department. After I get off work, I'll change clothes in my office and go to the department and exercise. And it became one of the things where initially when I would go, I could exercise in, undercover. No one knew who I was. The word got out, and it became one of those things where the patients were so pleased and so excited about the care that if I were on the treadmill, they'd walk up and want to talk to me about the service they've received at the hospital.
So now you're still working while you're working out, right?
And they would rave and go on, and then I'd get off and I'd get ready to go to my next, and somebody else. I had to come meet you and tell you what an amazing staff you have. I mean, everybody treats us so well here. And we even have, to take it to the next level, after these patients complete their rehab, they join the gym. They become members of the Broward Health Imperial Point gym.
So it's actually,
it's a gym. It's an exercise facility.
I didn't know if you just could do it because I know Marilia is so, well, is she exercising there too?
Yes.
That's why she looks so great. So anybody, so
members of the community, if you decide you want to come join the gym, you can come in, sign up. I don't want to quote the fee, but I know it's relatively inexpensive. I'd say between $10 and $15 a month to be a member of the gym. And we have cardiac equipment there. We have weight training there. And as a side, because it's a rehab facility, you can oftentimes ask the therapist questions about some of the exercises you're doing. They've coached me a couple times about exercises I thought I was doing appropriately, and we've been able to tweak those. And yeah, so again, it's an amazing hospital. In summary, Broward Health Imperial Point is an amazing place.
Jonathan Watkins, you're probably going to have a line outside of that.
We'd love it.
I mean,
yeah.
I could,
that would give me the support I need to expand and grow.
But isn't that unusual for a hospital to have something like that they invite outside people?
It is, yes. It's not something I've seen in many of the facilities I've worked in.
I think that's really
important. But it
important.
goes back to our focus on the community and on wellness and on maintaining health. We believe you do that by not only healthy eating but also exercise. And we want to provide an atmosphere and an environment for you to do just that.
Well, I'm glad you mentioned the eating, because
Yes.
I've eaten in your dining facility, and the food is very good.
It
there.
is, yes. I eat there often too, breakfast, lunch, and unfortunately sometimes dinner. I'm there just that late.
Right.
But yes, we have an amazing dietary team there and catering associates.
And so, as a CEO, you actually walked into something already prepared for you, didn't you?
Yes.
And now you're just kind of doing little, its and bits and things that to make it a little bit better.
Yes, it's how do we continue to tweak it and expand it so that it, again, is suitable and fitting the needs of the community. We perform a community health needs assessment annually. And as a part of that, we really want to just continue to keep our eye and our finger on the pulse of what's transpiring within the community. Is diabetes big? Is CHF, chronic coronary heart failure, big? Is COPD big? What are the initiatives and the illnesses that are plaguing our service area? So we want to make sure we understand those, and we know just how to treat them and what services we offer our patients.
And so, really, everyone reports to you. I mean, do all the doctors report to you? They have a physician that they report to, don't they? And then he reports or she reports to you.
So most of our physicians are community-based physicians. So we have what we call a hybrid system, where we have some physicians that are Broward Health employees, and then we have some independent contractors or some physicians that are part of different groups that have privileges that work in our hospital. So the physicians that are part of the Broward Health system report up through our physician service line, our physician group. We have a chief medical officer also in the hospital that supervises the docs and works with addressing some of their issues that reports ultimately up to me.
And do you have the same thing for nurses?
Yes, I have a chief nursing officer, Tony Reyes, that's doing a phenomenal job, and she's continuously working on how we continue to advance and excel what we do for our nursing care.
Okay, so you have different divisions, but now thinking about when someone first comes in, and I've noticed, you have a very nice lobby, and they come over, and you don't just have one little counter. I notice you have a lot of places where people can sit, feel good, relax.
Yes, ma'am. So when you come into the facility, we want you to feel welcome, so that at the onset of it, you're met by our patient access team that greets you, welcomes you, provides you with your visitor badge. You then come in, and there's another associate there within that same team that's able to find out and answer any questions, whether or not you're going to visit someone in the department or you're there for to register because you're the patient that's coming in for an outpatient procedure, or you're going to be admitted into the hospital. You're there then able to sit down, and that's when the registration team that you saw has the different desks in the areas where they're able to collect your information in a very patient and family-centered care manner, and then to provide you with the direction as to where you go next.
Yeah, and when people don't really realize it, sometimes you go into doctors' offices and they have the glass that goes across, and have to knock on the glass, and
no glass at Broward Health Imperial Point.
So open.
Yes,
and
no, we want to connect directly with the patient. We want again the community members that trust us with their health care to feel like they're part of the system. I want them to feel like they can reach out to me when and if necessary. So I round routinely in the hospital. The team will tell you I'll sometimes sit in the lobby just so I can feel the lobby.
I love that.
and understand what's going on, what's coming into the
Right.
hospital. Yeah, you get a real sense of the facility when you do that.
Yeah, we had a governor once that did work days.
Right.
And he would go, and one day he'd go to a restaurant, and the next day he was in a theater that I was involved in.
That's awesome.
That's right. And he could then tell, because you can't just tell sometimes. There's what's that book, Managing by Walking Around?
Right.
You remember
Yes.
that?
Mm-hmm.
That sounds like that's what you do. So
it is, yes.
So your training when you went to college, Did you know that you wanted to be a CEO of a hospital?
I did, yes. So I decided I wanted to be a CEO of a hospital as a junior in high school.
I was going to say when you were 5 years old, I can figure that out.
During a career day. So I'm a firm believer of exposing students to the field of healthcare administration, because it's not one that many people know about. Growing up, I thought I wanted to be either a doctor or a lawyer because that was the standard of success based where I grew up. That's what you aspire to become if you wanted to really make it and move on and buy a nice house and dress nice and drive a nice car.
Right. And make your mother and father proud of you.
Exactly. But as a junior in high school during career day, a gentleman, Dr. LaDon Jones, spoke to my high school and spoke very eloquently and passionately about the field of healthcare administration. But he more so struck me, and it's going to probably sound lazy, with the time that I would have to go to school. You go to school a lot less to become a hospital administrator than you do to become a physician. So it's 4 years of undergrad and then typically 2 years of graduate school. Whereas a physician goes to school 4 years for undergrad, an additional probably 2 to 3 years for medical school, an additional 3 years for residency, and then if you decide you want to do post-fellowship, post-residence fellowship training or anything like that, you could potentially be in school until you're probably my age now.
So Jonathan Watkins, CEO of Broward Health, Imperial Point, we're going to have you back again. You're just too charming.
Well, thank you so much. I appreciate you inviting me out.
Yeah,
I enjoyed
thank you so much.
You're more than welcome. Thank you.